Get In Connecting to Affordable Health Insurance is underwritten in part by a grant from the University of Arkansas Partners for Inclusive Communities and the Centers for Medicare and Medicaid Services.
Hello and welcome to Get In, Connecting to Affordable Health Insurance. I'm your host, Jancy Sheets. Open enrollment for the new health insurance marketplace is almost here, and our goal is to provide you with helpful information on how the healthcare law affects you. During the program tonight, we'll provide you with information about the Arkansas Health Connector. We'll also share how to access the new health insurance marketplace and discuss when open enrollment begins. You'll learn about income-based subsidies that could help with the cost of health insurance premiums. Most importantly, though, you can call in to our expert panel and get answers to all of your questions. Before we get to that, though, many people do have questions about the new health insurance marketplace, which was created by the Patient Protection and Affordable Care Act and how it works. Take a look at this short video, and we'll be back with our panel tonight to answer your questions.
Ever been in this situation? You're searching for health insurance, but if a plan that works for you is out there, you sure can't find it. Or maybe you aren't even searching at all because you think there's no way an insurance company would accept you, or no way you could afford a decent plan. It's no secret, too many Arkansans have been left out of any type of health coverage. Between expensive premiums and pre-existing conditions, 572,000 Arkansans aren't getting adequate health care. And a lack of health insurance is the only thing many of them have in common. We need a solution that can get more than 500,000 unique people health insurance that meets their specific needs. And actually, there is one. Arkansas Health Connector. Finally, Arkansans can get in and get insurance. Families are in. Children are in. Singles are in. Businesses are in. You are in. What exactly are you in for? Better health care and peace of mind. Here's how it works. Arkansas Health Connector, created as a result of the Affordable Care Act of 2010, will connect you to the health insurance marketplace, where you can shop for and compare insurance plans. To do this, simply enter your basic information and other details, even your preferred doctors when you enroll. You'll then be given the health insurance options that fit your needs. You can see what your premium, deductibles, and out-of-pocket costs will be for each plan, so you can choose the one that works best for you. Your monthly insurance payments, or premiums, depend on your yearly income and how many people are in your household. You may qualify for a break on costs through a new type of financial assistance called Advanced Premium Tax Credits. For example, a single parent with one child earning roughly $25,000 to $35,000 a year would pay somewhere between $90 and $200 each month. A married couple earning roughly $50,000 to $60,000 a year would pay somewhere between $395 and $475 each month. And a family of four earning around roughly $35,000 to $45,000 a year would pay somewhere between $110 and $215 each month. Some Arkansans will even be eligible to have all of their premiums paid through this financial assistance. The assistance you receive is unbiased and confidential. And again, the amount of assistance you get depends on your yearly income and how many people are in your household. Wondering if you're eligible? As long as you live in the U.S., are lawfully present in the U.S., and are not incarcerated due to a conviction, you are in. No more rejection due to pre-existing medical conditions. No more having to pay more because of past health issues. No more waiting periods. No more being left out of the coverage you need. The best part? By law, qualified health insurance plans have to cover what are defined as the 10 essential health benefits. This means preventive, wellness, and chronic disease management, prescription drugs, maternity and newborn care, pediatric services, including oral and vision, laboratory services, rehabilitative and habilitative services and devices, mental health and substance use disorder treatment, emergency room services, inpatient hospital services, and outpatient services are all covered. Several of these benefits aren't covered by most insurance plans on the market today, and a few aren't covered by any. Yet each is essential to your health. This coverage will begin January 2014. But until then, there are several ways the Affordable Care Act is already improving healthcare. For example, it is now law that preventive care, like yearly wellness checkups, mammograms, and colonoscopies, is available at no cost to patients. Children can stay on their parents' insurance until age 26, and insurance companies can't place lifetime limits on health benefits. Anyone who still doesn't have health insurance in 2014 will be subject to pay a penalty. But now that you have access to some of the best insurance plans on the market, you can't be denied coverage and may be eligible for help with paying your premium. There's no longer any reason not to have health insurance. Finally, we're all in. Beginning October 1st, 2013, you can enroll online, by phone, by mail, or in person. So, mark your calendar and get ready to get in. The search is over. Go to arhealthconnector.org to learn more.
And this video pretty much simplifies what so many people think is such a complex topic. By the way, you can find that same video by going to arhealthconnector.org. Joining me tonight are representatives from the Arkansas Insurance Department. We have with us this evening Commissioner Jay Bradford. We also have Deputy Commissioner Cindy Crone, Bruce Donaldson, a stakeholder and producer specialist, and Sandra Cook, Consumer Assistance Specialist. We also want to remind you to call in your questions tonight. We will be having a panel answering your questions tonight. The number to call is 1-800-662-2386. Thank you all for being with us and joining us tonight. Let's start off with Commissioner Bradford. What is the law? How will the Affordable Care Act affect Arkansans? So many people are curious. Come January 1st, what is going to happen?
Well, the January 1st date is the effective date of the Affordable Health Care program for the United States of America. What we're doing now, starting in October 1, is going to assist Arkansans and educate them of their options as far as enrolling for the January the 1st date. There's going to be a lot of resources available to the citizens of Arkansas to help them learn what their options are, the plans that are offered, which companies, also the pricing, of course, that will be available to them. All of those facts will be made available to enable them to make a decision come January 1st or prior to that, because the enrollment, as I said, starts in October, to be effective at the first of the year. There's several ways they're going to be able to get help. Number one, the telephone, which is a tradition here in Arkansas.
We hear it going on behind us right now.
That's tonight. You've got the 1-800 number. We certainly want, we got great people here available to answer questions, and we're going to field questions also. The agents, the insurance agents state are getting geared up to help their clients and other people to learn about their options on this program. In-person guides and sisters. These, there will be some 500 people in the field across this state that will be given impartial information to the public, so they'll be informed and be able to make the right choice for their family. And also the mail, the snail mail, of course, there'll be a process for that. So we're going to talk about all of those options tonight. And we will, at the end of the day, people will be prepared to purchase the insurance through the Federal Exchange from private insurance companies.
And so the law is pretty much that everybody must have insurance by January 1st.
Well, it's not quite that. It's not quite that strident. The individuals will be able to apply starting, first of the month, and it'll be effective January the 1st. And they will have the first year. People can sign up for the Affordable Health Care Act. Eventually, people who do not sign up, individuals, there will be a small penalty on the front end to encourage them to do so. It's really going to be a very positive situation because of the tax credits and the other private option process that is going to really help Arkansans get this needed coverage. We're talking about 500,000 Arkansans that are really without protection now.
That is a large percent of our population who this will affect come October 1st. And Cindy, the Arkansas Insurance Department, they have created a website that makes it so easy. That same website has that 5-minute video that we just saw, and it's called arkansashealthconnector.org. Tell us what this is and how it's connecting people to the actual health insurance marketplace.
Okay, the arhealthconnector.org will actually have a link to the federal health insurance marketplace, so someone could go directly to enroll, and now they can go and set up their account. So even before October 1, individuals, families can go to an account set up, have their information, and be ready ahead of time, ahead of October 1. The website also has information that can help people learn more about the marketplace, about their options, about insurance, about health.
So what is the health insurance marketplace that we keep talking about?
Well, it is like a shopping mall where people can go and look at plans and compare them to see what's best for their family and best for their budget. So it's talking about apples to apples comparison. You might see the benefits and what are the out-of-pocket expenses for you. So when you go to the marketplace, real time you'll be able to know what it will cost me every month and what will the benefits be that I get for my family.
And who is eligible to enroll through the marketplace?
Any Arkansan who does not have insurance, who's under 65 and not on Medicare, could very possibly be eligible. Now, if you have company insurance with your employer, most of those people will stay just where they are. And if there's some unusual circumstances where it is unusually expensive, they can also migrate to the exchange. But most of this is going to be designed for people who are small business people or individuals. The 500,000 people who today do not have protection. This process where we have the guides, some 500 guides out there, they're there just to assist the Arkansans, to help them learn what the best choice is for them and to explain to them the certain credits that they're eligible for based on their income. They don't sell insurance. They don't recommend a specific insurance company, but they'll give you your options. And that's going to be quite helpful to the public.
And Sandra, Bruce, you want to say something?
Yeah. Also, the commissioner alluded to the small business. The small business owner between 2 and 50 full-time employees will be able to buy group plans on the marketplace, and perhaps those with less than 25 employees will be able to be eligible for tax credits, so that the employer can get help paying his premiums, his contributions towards the employee's premium. So also small groups will be able to buy on the marketplace as well.
Does that go into effect now, or is this one of the items that has been postponed?
No, it's the same thing. Okay. They can start looking at the plans October 1st. I assume that the agents and brokers will be very busy because the small groups they traditionally use agents and brokers, and I believe they'll continue using agents and brokers to compare their plans, and so they're going to have a lot of work to do to show that small employer, the advantages or disadvantages of moving to the marketplace plans or staying on their present group plans that they are now. So they're going to have a lot of work there.
And in our state, most people work for concerns that are 50 and below. We have a lot of large companies, but when you get down to percentages, most people will be eligible to get on the exchange. A lot of employers, small employers who haven't been able to afford to provide insurance for their employees, just with the tax credits and everything, it's going to enable them to do so. And then there's many people who will just be eligible for an individual policy. They're going to be added in with a group of thousands of other people, and in the long run, that's going to be a very powerful buying group.
It'll spread the risk.
It will,
yes.
And it'll take us a while to get there, but it'll build to that effect. And with the improved health for Arkansans, with the large numbers that are going to be participating in the group, it should lower the premiums, and it's a real. The long-term effects are very positive.
I want to go back to the guides that the commissioner was talking about. Sandra, you work closely with these guides. How many are out there? What kind of training have they had, and what are they doing to help people enroll?
Okay. Well, we plan on having over 500 guides. Currently, we have about 300 who have gone through our phase 1, and quite a few who've gone through phase 2 of our training. Our training is in 3 parts. The first part basically prepares them to go out and do outreach and education. The second part is a federal online training that actually teaches them how to use the marketplace and all the federal requirements. And then the third piece is state specific. So it talks about Arkansas's private option. It talks about things that are specific to Arkansas. Once they've completed those 3 phases of training, and this is not just for guides, this is also for navigators, it's also for agents and brokers who have to have an additional license in order to sell on the marketplace. They then will apply for a license from the Arkansas Insurance Department. They will all be background screened, so we're trying to make sure that we are protecting the consumer. And right now we have, like I said, about 300 who have gone through training already and are out there doing outreach and education. We actually have one group, there's 3 of them in our phone bank who are helping. They just finished, the 3 of them just finished phase 2, and they're getting ready to go to phase 3, so they'll be ready on October 1, licensed and out there to help folks. And the guides are not paid by insurance companies, and they don't have any vested interest in what plan a consumer picks. They simply are going to give them fair, impartial, and accurate information so that they can make the best decision for their particular family. They will assist them in understanding what their options are. As we said, we have over 500,000 folks who are uninsured, many of whom who've never been insured and don't understand the terminologies. Even those of us who have insurance don't always understand what copays and deductibles and co-insurance are. So they'll explain all of that to them so that they can really make an informed decision about what's going to best meet the needs of their families.
Heather Haywood with the Arkansas Insurance Department said the acronyms for all the health insurance words are just pages and pages long, and a lot of the common people out there don't know any of this stuff. So it is something that you have to research. You mentioned the private option, and this is something that is unique to Arkansas. What is the private option, and why did Arkansas opt to go this way?
Well, it was a brilliant concept, and it was developed by our legislature. And rather than expand Medicaid, which was an option, to expand it to people under a certain poverty level, what our legislature decided to do was to take the federal money and, for those people who are qualified, purchase insurance on the exchange, where they will have a standard insurance policy from an admitted insurance company, just like all of us are the same. And it's privatization, it's commerce, and it really is. We've got states, and Cindy could be on a panel every 3 days in some state talking about the private option and how it's going to work in Arkansas. So we should be real proud of that. It was really a forward look from the legislature, and it's going to help a couple of 100,000 people, and the providers, the hospitals, who will benefit tremendously from these people. They have to see everybody in a hospital. When they go to the emergency room, if they're sick, they have to treat them. This way, we'll have people that will be able to pay for those services, and it will mean a tremendous amount to our hospitals, especially in the smaller cities of the state of Arkansas, and the long-term effect on the rest of us who are lucky enough to have an insurance policy. Embedded in those costs are the costs for these people who don't have insurance. So it's going to save everybody money in the long run to have this private option. And it's an exciting process. The state of Arkansas will benefit from it greatly, and so will a lot of Arkansans.
And you mentioned, Sandra, did you have something? Okay.
I was going to say it was really quite a brilliant kind of a plan, and it's a win-win for everybody. The consumer wins because they no longer have a stigma of being on public assistance. The insurance companies win because they've got over 200,000 lives that will be paid for. The providers win because now they get paid. Now you have like the commissioner said, some small towns where if you graduated from UAMS as a doctor, you might not go to because half the population in that county is uninsured. Now they're going to be insured. So now it would be more of a draw for people to say, you know, I think I might want to practice in a small town somewhere. So it's really a real win-win situation. We're very happy about it and very proud of Arkansas for coming up with such an innovative idea. And as the commissioner said, we could be all over anywhere because everybody's looking to see what we're doing and to see how this works because it's really, really very creative.
One other thing that's really important about it is that the consumer who changes their income above and below that level to be eligible for their premiums to be paid by those federal dollars or paying more of their premium themselves can stay in the same plan, keep their same healthcare providers, and not have to change their private insurance policy. So it keeps them insured, keeps their coverage active.
These are people that didn't necessarily qualify for Medicaid. And you said they're expanding Medicaid. What is the federal definition of poverty with the new standards?
Yeah, those who are at 100% of the federal poverty level would be an individual with an income of $11,490. But an individual with an income of $15,856 would be eligible for the private option. So they would have 100% of their premium paid. Now those between that $11,490 and $15,856 would have some pay. They would pay some co-pay, some co-insurance. And in future years, those even under 100% may pay a little. But by and large, that poverty level tells us where the government pays and where the individual pays. And it's a sliding scale fee. It goes beyond private option. So the way it works is the amount of help or subsidy I get from the government is based on how many people are in my household and what my income is. So that poverty level that I mentioned at 100% goes up to $23,550 for a family of 4, or $32,499 for a family of 4 to get the private option, or on up to $94,200 for a family of 4 at a higher level to be able to get some help in paying their premium. Because our income compared to other states is lower, many, many Arkansans will be helped. In fact, probably 78% of Arkansans will have incomes under 400% of the federal poverty level so that they can get assistance and have affordable health care.
So that's something you need to do now is collect all your financial information. So when October 1st rolls around, you'll have it there. And this is based on 2012 income?
It would be based on 2012 tax returns. If you don't have that, you can use your current pay stub or other income. So you need to know how many are in your household, what is the household income for everyone contributing in that household, and a few other things like your address and your age, and you're ready to do pre-enrollment.
Yes, it is.
Let's put a face on that.
Okay.
$32,000 a year in the state of Arkansas, those are young people, young couples, young families who really have not been, they've never been eligible for Medicaid, and they have not been able to pay the current insurance premiums on $32,000 a year, and we have a lot of people that fall in that category. So it's not someone who is impoverished or who doesn't have a job. This is younger people that are working hard, coming up the ladder of success, that just could not pay their utility bill and their rent and their diaper bill, $32,000 a year, but they were getting a loan. They couldn't add an insurance premium on top of that, so they just didn't have it. And that's why our bankruptcies are so high in Arkansas. You stay 10 days in the hospital and you're bankrupt. So it's not a handout, it's a hand up.
Just helping people that are working hard.
And there's a lot of people that fall in that category in this state, and so that process there is so important just for the continuing health of our state too. People having to pass up going to the doctor. At the end of the day, they get critically ill They go to the hospitals do treat them, and the bill goes out to everybody. So, I think people need to understand that, this really fits our demographics pretty well, and we're going to take care of people that are out there working every day.
We want to continue to call in today. The number is 1-800-662-2386. We have representatives here that will be answering your questions, and we want to take a few of the questions from viewers tonight. Cindy, I'm going to address this one to you. This viewer wants to know, what is the difference between Access Arkansas and the health insurance marketplace?
Access Arkansas is a state portal. And the health insurance marketplace is a federal portal. So both can get you to where you need to go, but when you start in the state, when you start in the federal government. Both can help you determine eligibility. If you're too high for a state program, it will move you electronically to the health insurance marketplace. Conversely, if you start at the federal level and your income is such that a state program will help more, it will move you back to the state.
Okay. Sandra, I'll give you this one. This is a caller who is out of Pulaski County. If I'm 65 and on Medicare, do I need to sign up?
No.
Okay, simple as that.
Simple, very simple.
So your policies will stay with Medicare and you don't have to do anything?
Exactly.
Okay, same thing you were saying too. If you currently have insurance through an employer, or if you're happy with your plan, no need to do anything come October 1st.
Exactly.
That's the one thing we've been talking about, our tax credits, but we really didn't explain that to the viewer. So what the government has said is that because the costs of insurance have been unaffordable for many young starting families or older families because they have health problems and they have higher rates, that there is help and that no one should pay more than 9.5% of their income. And that's at the higher level. So lower income people would pay less, 2% of their income. So the income someone has and how many people are in their household will tell how much financial assistance they get, so that their premiums become affordable. And the advanced tax credit means that the Treasury will pay some of their premium directly to the insurance company so that what's left they can afford. And if they still can't afford it, then there is a way that the IRS can help, and they settle up kind of at the end of the year when they pay their taxes.
The cost is a huge question. I know a lot of people have asked, how much am I going to pay when these plans go online on October 1st? Estimate, what are we talking about? What are these going to cost individuals? Do we have any idea at this point?
We can't tell you the cost yet. We're waiting at the federal level for that to be determined finally. We think the costs are going to look pretty good as they have in other states comparatively. We can't, until maybe this week, next week, have that final answer for the consumers, and they'll be able to actually shop starting October 1. But excuse me, Commissioner?
I think that on the cost issue, we've got to be mindful of the fact that when a premium is quoted through the new federal exchange, then you start taking those discounts off of it because of the income levels and all that. So what might be shocking on the front end, once you go through the formula, how many kids you got, what your income is and all that, it's a buy-down situation.
You may be a little happier when you get down here than
Yes.
what you started with up here.
Yes.
What types of plans? I understand it's going to be a tier system, so you don't have to go with the highest plan. I mean, there will be alternatives.
Most of the subsidies are based on what's called a silver plan. And that's a plan where the insurance company pays 70% on average and the consumer 30%. For some lower income consumers, they even pay less than that. They may pay 0 or they may pay 5 or 6%. You can buy up to a gold or platinum plan, or you can buy down to a bronze plan. But really how it works is the more you pay in premium, the more the insurance company pays. So it costs you more on the front end and it costs you less if you're ill. The less you pay, the more you have to pay for your health care.
And your guides and your agents will be able to help you with make those decisions and everything, to give you those scenarios so you'll know what's the right level of participation for that individual. And so it might sound difficult on the front end, there's going to be a lot of help out there for our
That's one of
consumers.
the things that the guides will really help with, because a lot of times people think just, okay, if my premium is low, that's going to be the best plan for me.
But not necessarily if you're going to the doctor every week. That's not-
Exactly.
yes.
So if the copay and the doctor is $100 a visit, and you see the doctor 3 or 4 times a month, you probably don't want that bronze plan. You probably want a plan where you're paying a little bit higher premium, but you're only paying $10 each time you go to the doctor. So those are the kinds of issues that guides will help explain to the consumer.
And Bruce, these health plans have to have 10 essential health benefits. Give us a couple of examples, or any one of what these essential health benefits are.
There'll be the hospitalization, outpatient, there'll be emergency room, maternity, prescription drugs, they'll all be covered. A couple of new benefits, pediatric dental, pediatric vision will be there, as well as rehab, and another new benefit, habilitative services. So there'll be 10 essential benefits that will comprise these new plans.
Okay.
And there's one important one that is substance use disorder and mental health services. That has, for several years, been a requirement of the government that if a plan offers it, it has to be equal in its offering to medical services otherwise. But now it's an essential health benefit, meaning that all plans must offer that benefit.
Okay. And some of the actual benefits of the Affordable Care Act have already gone into place, and one of these has to do with kids staying on their parents' insurance longer. Tell us about, Cindy, if you want to address that, what is in place right now, and then is anything going to change January 1st?
Children may stay now on their parents' plan until age 26, which is a real help for college students or a young adult just getting started with low income. Those children can stay on even if they're married. Now, their spouse cannot be on, nor their children, but the child can stay on to age 26, which is a tremendous help. And I think one thing we've learned is that young people want to be on if they can afford it. So this is one way they could get to it, and now they will have an option to have some help as they're getting started with young families.
And another thing that is going to affect pre-existing conditions, Commissioner, if you want to address this, that's no longer an issue.
That is such an important change, the pre-existing condition, because quite frankly, under the old system, most people, especially when they mature a little bit, are going to have some type of health issue, or they've been to the doctor for some treatment. Under the old system, it made it very, very difficult to get insurance, and sometimes if you got it, it cost additional premium because of those issues, or you had an exclusion for that ailment. And so that's all going to go away after January the 1st, which means it's so important. And, well, we've all heard about people who could not change jobs, they couldn't retire early because they had a health condition, they had to stay where they were because of their health insurance. Well, that's going to negate that. So someone who's 55 years old, they're not eligible for Medicare, of course. So there's a 10-year window, and if they have high blood pressure or something like that, they're stuck. They're no longer stuck.
They're
going to join this large group of Arkansans, and they're not going to have a policy that's any different from a 21-year-old healthy person, except the price will be a little bit different because of age.
That group is going to be really helped, that the commissioner mentioned, that pre-Medicare age, but often with some health conditions.
Yeah. And then can you think about being locked into a job and maybe even have an opportunity to start a business? And you couldn't do it because of those health issues. And it's an employment issue. Our growth is in small businesses, and this will help those flourish.
And that makes me think of one other group that we didn't mention with our new benefits, and that's wellness and chronic disease management. And so now already, and again in 2014, people can get their annual checkups at no out-of-pocket expense. They can get their pap smears, mammograms, colonoscopies, their cholesterol screens, all the kinds of things that we do to prevent and early detect and manage health. We can do now with an incentive of no out-of-pocket costs. So we really not only look at helping our pocketbooks, but helping our health and our lives.
Prevention is a lot cheaper than treatment.
Absolutely.
Another change is lifetime benefits, and hopefully I'm using the correct term on that. There is no longer a lifetime benefit. Is that right? Like a max.
That's right.
When you get to a point.
And in unusual cases, that is very, very important. People that have long-term illnesses, it's very devastating financially. And you can get to $250,000 real quick. So
A
that's
premature
gonna
baby could have been excluded for a lifetime and no longer.
Okay, we want to take some more of the viewers' questions. Give you that number one more time, 1-800-662-2386. We do encourage you to continue calling in with any questions that you have, even if you think they're frivolous. They're not frivolous, and we have the answers hopefully for you tonight. This caller is from Cherokee Village, and this, Cindy, will address this to you. If offered, let me see if I can get through this. If offered through employer, can I use, the husband is employed and wants to drop the wife and sign her up through the marketplace. Can you do that? If she can get insurance through his company.
If they offer family coverage, and the companies must offer dependent but not spouse coverage. So if spouse coverage is offered and it's affordable, meaning it's no more than 9.5% of his wages, and it's at least 60% actuarial value or 60% the company pays, then she would not be able to get a subsidy in the marketplace. Now, nothing would prohibit her from shopping there, but it may not be to her advantage because she might lose the contributions of the employer. So if the employer offers affordable coverage and offers spouse coverage, then she would not be able to get a subsidy in the marketplace.
And Bruce, this goes to the employee also. If your employer offers coverage, you may have a better deal if they contribute to your health insurance instead of going through the marketplace.
Right. You have to remember the employers contribute at least 50% of the premium for the employee. So the employee's getting help paying his premium, and any contributions the employee pays towards that premium is also pre-taxed. So the employee has a tax advantage, as well as the employer can also write it off as a tax write-off on his contributions. So in most cases, it's going to be more advantageous for the employee to remain on the group plan. If it's offered to him and it's affordable, he's not going to be able to get a subsidy on the marketplace. So chances are he's better staying with the employer coverage.
How does this also affect COBRA? I know that I've been in that situation. You're transitioning from one job to another. You need coverage, so you go through COBRA. Will this exist any longer? Or will you just go to the health insurance marketplace?
Well, it does exist, but the need is not like it once was, because the reason usually people stayed on it is they couldn't get insurance or affordable insurance because of the pre-existing condition often. So this would go away, and there are times with what's called a significant life event that outside that open enrollment period, which this year's October 1 to March 31st, and in subsequent years will be a shorter window, that you would be able to come and get insurance outside of open enrollment. Losing a job would be one of those times. So COBRA is not gone, but the need for it will not be nearly what it has been.
And you mentioned that window to sign up in. The earlier you sign up, the earlier your coverage begins. We want to reinforce that, because if people put it off, their coverage will be put off until
now
into
the
next year.
earliest coverage can begin this first year is January 1, but you make a very important point. Our viewer who is going to go to the marketplace would want to sign up by December 15th to have coverage effective January 1. And the reason is that if you sign up the first 15 days of the month, your coverage starts the first of the following month. If it's after the 15th, it's the first of 2 months out. So for this year, by December 15th would be very important.
How do you enroll? You go to the marketplace, and if you don't enroll, what is the penalty?
Well, there's a lot of ways to enroll.
Okay.
You can do it online, as I've said. You can do it by a paper application. You can go to your insurance agent and
Call
they
center.
can process it. There'll be active call centers. And you've got, like I said, the traditional way by mail and everything. So it's going to be, everybody will be comfortable with some method to get there.
And if you don't get there and you don't enroll, what are you looking at?
Well, if you don't get there and you don't enroll, I don't remember exactly what the early penalty is on that. You'll have to help me on that, Cindy.
Well, you have to be covered at least 9 months of the year to not get a penalty. And the first year, 2014, the penalty is fairly low. It's $95 for each adult in the household, and half of that for the first 3 children. The second year, it goes up to $325 for each adult and half for the children. The third year, it's $695 per adult. So by the third year out, you're spending a lot of money and you don't have health coverage. So spending the same or less with the help, people can get covered. So it's really estimated that very few will get the penalties. Maybe less than 2% of people are expected to pay the penalty.
And moving on to some more questions from our viewers. This viewer is out of Pulaski County. Anyone who wants to answer this, once signed up, how do you choose your doctor, and do the plans have doctors working with them? So how do you know if your doctor's covered or not covered under the plan you choose?
Well, when you go to compare the plans, once you set up your account and you go and you view the plans that are available to you in your area, what you'll be able to do is they'll provide a link to the network of physicians and hospitals. So the person searching for that plan will look to see if his doctors and hospitals that they are accustomed to using are in that particular network, or they can go to the next carrier and look at their website and see what doctors are active, and they may have a doctor that they like that they can go and check on that same link to see if they're in that network. So there's a way that they can do that kind of checking online while they're comparing plans, which is very important.
And they can call their doctor's office and ask.
Yeah,
If it's covered.
that's the best way to do it.
And these are all private insurance carriers. This is not
Exactly.
government insurance
Not
that you're dealing with.
government.
This is private insurance carrier.
Have you guys found that the majority of doctors and hospitals are signing up for all of these plans, or do we not even know that yet?
Well, I would say that, yes, typically
Okay.
the majority will.
Another question here. This one is from Union County. Cindy, married couple, will they look at total household even if filing separate on their income tax?
Yes, to look at the household income.
This caller is out of Faulkner County, and Jay, will have you answer this one. I'm reading this cold, so bear with me. How will it affect people who have private policies right now, receive letter from BCBS that their policy will go away 2014? Should she expect policy? Is this component in the law prohibiting insurance companies? If government's paying, how is it different from traditional Medicaid? If you got all of that.
Well, that's a complex.
It's a lot of questions.
That's several questions, but we'll take a shot at
Okay.
it. Okay.
Let's start with how will it affect people who have private policies?
Okay. Well, you have a policy, and you'll be able to continue that policy until it renews. And when it renews, it will have all these nuances and these broadened coverages that we've been talking about tonight. And so that is a orderly process to get you to. You don't have to cancel it on January the 1st, and you'll go out the policy period. Now, we need to separate this Medicaid issue from the affordable health care, because anybody who qualifies for a policy under the private option, the premium or portions of it will be paid by the federal Medicaid program, but they're going to have a policy that's purchased from a standard insurance company, will not be different from anybody else's policy all up and down the income stream, and it'll be their policy. And let's just say they get a great job or go in business for themselves, they'll be able to continue that same policy, the same coverage. They won't have to start over.
Just federal dollars will not be paying for it. They'll be paying for it at that point.
As it goes on a sliding scale. And the other side of that coin is just to say what happens in our state, because it's an agricultural economy and is geared to the timber industry in a lot of areas here. So if you have a point in your year where you don't get to work because of the weather or because of conditions like that, you don't lose your policy. Your income would slide down where you'd get more help from the private option, but you would keep your same policy. And that's really important when you're going to your doctor or you're under treatment for something, where you don't have to be interrupted in that process.
How about the receive the letter from BCBS that their policy will go away in 2014?
Well, they're all going to eventually go onto this new format.
Okay.
Yes.
So it applies to that one.
Now, your group insurance that you have through your business, as long as it meets certain standards, that's not going to go away. But the individual policies will have to meet these broadened protection perimeters as they renew.
I think I need to call a guide to walk me through some of this.
the consumer could buy a policy outside or inside the exchange, and if it's the same policy outside or inside, they have the same benefits and the same cost, and the pool is larger, which helps keep the cost down. So everyone doesn't have to buy in the exchange. You can only get the subsidies if you buy in the exchange, and the policies inside and out, starting into 14, will have more benefits.
Cindy, I'm asking you this one too. This caller is out of Faulkner County, a 19-year-old, and we addressed this earlier, but we'll talk about it again. A 19-year-old that is ending coverage. Is she eligible to shop on the exchange? She's unemployed, and what can happen if you can't afford coverage? But we were talking about that she's covered under her parents' plan.
Right. She could be covered, but her parents may not have a plan. They could be one of the 500,000 uninsured. So a 19-year-old who is unemployed would be eligible, and they would be able to get 100% of their premium paid because they have no income. And if they have no income, they also would be able to have their other expenses covered, their other out-of-pockets. As her income would raise and she begins to get a job and raise herself, then her contribution would accordingly raise.
This caller is out of Washington County, currently on Medicare with a supplement. Will supplements increase due to federal government subsidizing private option plans?
No.
No.
The consumers on Medicare get the same thing they have, and they won't lose any benefits.
Right. This is another Medicare, and I'm reading these cold once again. So I have Medicare. What are the expansions going to be, and can I choose a plan from the marketplace to fill the gap? And we have touched on that over and over also.
No, but one thing I might mention, not in the marketplace, but a part of the new law is that what's called the donut hole, the prescription drug kind of barrier there, will begin to go away. So by 2020, that gap will be eliminated, and so that Medicare recipient will be able to get more help with their prescription drug costs.
But as of right now, Medicare recipients, they still would need private, maybe
for their
subsidies.
supplements.
Yes, for their supplements.
Yes.
To buy private insurance with that. The actual enrollment date is October 1st, but there are things that you can be doing right now. We've touched on this briefly. Anyone who wants to answer this, what do you need to be doing at this time to be prepared when October 1st comes around?
Well, you can go in and set up an account. Your account, you'll have a user ID, a password, and you'll put in your information, your family information, your spouse, your children, social security numbers, addresses, and then you'll start to put in your income information and get it ready for October 1st when you can actually go on, and then from there start to go look at the plans and find out how much they will eventually cost you, bottom line.
And also ask questions right now and get all your answers to all of your questions and have those ready.
One thing I'd like to add, because we've had a lot of questions in the office about the security of their data, if they input that. It's a very secure system. IRS is very secure, and so this data is protected, and it would be similar and more protected than online banking.
But people are trying to take advantage of this whole enrollment system, and I know that you issued a warning to consumers about scams going on. Tell us just what that is and what people should be aware of.
That's a very valid point, and I'm glad you brought it up, Nancy, because whenever you have these changes such as this, there are bad actors that are going to try to take advantage of that. And on our guides, who will be certified, they will have credentials and license that everybody has a certain right to ask for those credentials when someone happens to call them, or if they go to a meeting and there's someone making a presentation. And you can also call our department and check and see if that person is a licensed person. That also gives us a right to enforce standards on these people. And what we would do, just as we do now with a licensed agent, if they're a bad actor, we take them off the streets when we find out about it. So that's one reason we have that licensure protection for the public. Beware when you talk to people. If someone calls you on the phone, all that.
Don't automatically give them all your personal information.
Don't give
Check them out first.
Yeah, we all know that. I mean, but there'll be more and more people that are going to be doing that. This guide system is not over the phone system. And so,
and it doesn't cost anything. So if somebody says, I need $100 to help enroll you or start your account, they're not the real deal. There's no charge for signing up.
So the guides are helping absolutely free. They're not going to ask for any payment.
No, absolutely not, and they won't offer any incentives.
Put the input in.
For instance, they won't say, "Oh, you can get a $25 Walmart gift card if you sign up with me." They won't offer any incentives. And one of the things that we're doing right now, this period prior to October 1, is a lot of outreach and education. So we have our media campaign, we have our guides who have been trained through phase 1, who are going out and doing presentations in the community. And they are explaining to consumers that if somebody asks you for money, if somebody offers you an incentive, they're not the real deal. They have to be licensed, as the commissioner said. And as a consumer, you have the right to ask somebody, "Let me see your license," to make sure that they are who they say they are. But we're doing a lot of education of the consumers now to tell them this whole Get In campaign is to tell them this is the real deal here. It's because you see a lot of different advertisement on TV now for all kinds of insurance things that everybody's saying, get in, sign up now. Well, you can't sign up now. Okay, so that's not part of the federal marketplace.
And the Informed Communities is actually the campaign that's going on to raise awareness about this out in the communities.
Exactly. We have a speakers bureau that goes out and does presentations. Cindy, I think, was in 3 places today, and we're all running around trying to make sure that we get the word out. This TV appearance, radio, talk shows, just anything that we can to get the word out to the public of what the facts are, what's actually going to happen, and not so that they won't be fooled by scams. Because as the commissioner said, whenever anything new starts, there are these creative people who use their creative minds for stuff that's not good, so.
This question it's also about the guides. This is a caller out of Saline County. Are guides available now? And can you get information right now?
Yes, you can.
How do you do that?
On our website, we've listed all of the organizations. Oh, yeah. They can go to the Arkansas Health Connector, and all of the organizations and the counties that they serve are listed there. And they can contact those organizations directly. Guides will come out and do presentations anytime. Anybody, if a Lions Club or your women's health ministry in your church wants somebody to come out and speak, they're available to do that and to educate the public. And then they can also call this 1-855-283-3483, which is our resource center number.
This is the last question probably we're going to read. This is out of Benton County. Does not have medical insurance right now, but will be eligible for employer coverage come March 2014. Will they be penalized for not having coverage from January to March?
No. If they keep coverage for the rest of the year, if they're more than 3 months uncovered, then they are risking the penalty. They're covered any day of the month, they're counted covered.
Just remember, though, if they're not employed, they may be eligible for the marketplace starting January 1 to take them up till March 1st when they're eligible for the employer, probably at little or no cost, depending again on their household income. The spouse may work, or if he's not single. So there's still an opportunity for him to get coverage for those first 2-3 months.
When you enroll, you can do it on a month-to-month basis. You don't have to sign a contract for, say, a year of coverage or 2 years of coverage. How will this work?
You come in for a year, but you pay your premiums monthly, and there is a grace period, but if you fall behind, you're expected to catch up. And just like now, if you don't pay your premiums over time, your policy's canceled and you lose your health coverage.
This is a new question. I have not heard this one before. Will policies cover services in Arkansas only? We live closer to Memphis. Will plans cover services out of state?
That's
a tough one.
Yes. The plans in Arkansas, they're going to be mostly either point of service or PPO plans, and they will have out-of-state coverage. It may be out-of-network, or if it's one of the carriers that has a network out-of-state and they access those providers, it'll be in-network. So it all depends on where they land out-of-state, but they will cover out-of-state claims.
It just could be a little bit more out-of-pocket.
It might be a little bit more out-of-pocket, but like emergency room, if it's an emergency, it's generally paid at 100% no matter where you go. So yes, there will be coverage out of state if you should go out of state.
Those border issues, that's a very appropriate question to ask the carrier. when you apply, or the agent, and say, that would be a question, and see what arrangements they've made. You're talking about West Memphis. Almost all carriers have a provision where you can go across the river where there's other hospitals. But that's an appropriate question, and that could guide you into who you buy the policy from, who has the network that better suits you as an individual.
Especially if you travel a lot, but just remember, we are all covered with our policies out of state.
Well, we are almost out of time. The president is about to take over for us here. Cindy, quickly just recap, what do you need to do right now, and how do you enroll come October 1st? 30 seconds.
Right now, you know that we're 20 days out from October 1 when you can really enroll. You can do a pre-enrollment now, an account set up. Go to healthcare.gov, www.healthcare.gov, and set up a pre-account today. Get ready with your address, your age, your household income, your household size, and really maybe your W-2 form from last year, your pay stub.
Okay, and also that informative video on arhealthconnector.org. It simplifies it all. I know I was overwhelmed when I started researching this. I watched that and I went, oh, okay, I got it now. So that's very informative also with that. And we want to encourage you to go to that website also, arhealthconnector.org. Lastly, who can enroll for everybody out there?
19 to 64-year-olds, children, small businesses with 50 or fewer employees, and really anybody under 65 should check to see if they're eligible.
Okay, and this is going to affect about 500,000 people. Well, thank you all so much for being here tonight and for informing us on this great subject. And we hope you have a wonderful evening and have learned lots, and continue to call in with your questions.
Get In, Connecting to Affordable Health Insurance is underwritten in part by a grant from the University of Arkansas Partners for Inclusive Communities and the Centers for Medicare and Medicaid Services.